640 at KLIF. Good morning, I'm Dave Williams with Amy Shondroff. Recently, I went through this with my doctor, and I like my doctor, but I called the office and said, hey, I was in there a couple of weeks ago, and she gave me these antibiotics. I've been having a sinus infection. Right. And I took them all. They're all gone, but the sinus infection remains. So I need something else.
So you need a second course.
I need a second course
stronger.
Or maybe something stronger.
Right.
Then, well, we'll have to make you an appointment. Why? You already know what I've already been in there for this problem. Well, we can't make a prescription without a problem. And it just drives me crazy. It's expensive to go to the doctor. My health care is not taking care of it. So it just drives me. It's like, I don't understand this. And now I find out it's actually legal to prescribe medicines over the phone.
Yeah, there's a company called Telehealth that allows patients to get diagnoses and prescriptions from doctors over the phone and online without necessarily going in for an appointment. But the Texas Medical Board put a rule on the service that restricted it in many cases. And now a judge has put a temporary injunction on those restrictions, allowing telemedicine to continue. Dr. Pamela Smith is the director of the Center for Personalized Medicine in Michigan. She joins us now to explain how the board may have impacted the health of North Texans. Good morning, doctor.
Good morning. How are you this morning?
Good. I didn't even know such a service existed, or you could even diagnose online or on the phone.
Well, you can. And there's some interesting questions on this because right now, the way medicine is practiced is the doctor holds a license in a certain state. And the rules for the practice of medicine are different in every state.
Okay, so what if I leave Texas for a vacation or something, and I need to have my doctor give me a prescription, or I've got a little pain, or I've got some reason to contact her. Is she able to prescribe to me while I'm out of state?
She's able to prescribe to you while you're out of state. Absolutely, no problem with that. But the rules are different in each state. For example, I hold my medical license in Michigan, and one of the things I specialize in is looking at hormone replacement in both men and women. Testosterone in Michigan is a controlled substance, and so it would be harder for me to write a prescription for that to be filled in another state. In fact, I could not. I could not, for example, give you a prescription for testosterone that you would have filled in Texas because it's a controlled substance and cannot go across a state line.
So why is the Texas Medical Board putting restrictions on this type of practicing medicine?
Well, from a physician's viewpoint, we always like to see the patient to make sure that we don't miss anything, but also we want to have that human contact. When we see the patient, we touch them. And studies have shown that that actual touch has healing properties from the viewpoint of really just helping the patient feel better. I totally understand why telemedicine would be very beneficial, however. If you're in a rural area and there's not a specialist available, it would be great to have another specialist there to offer an opinion, and that would be wonderful. And so the Texas Medical Board did give provisions for that in telemedicine, where if it was in a rural area, the patient would be with a nurse clinician, for example, or another medical facility, and then a doctor in Dallas, for example, could help facilitate with a doctor in Boston. So the Texas Medical Board did give that provision. However, the injunction is there so that telemedicine would be in Texas for everybody, from a doctor from any state. It would be great for patients to have specialists from all over. It would also be great for patients to have group visits and a lot of new things that we're looking at in medicine. So there's honestly two sides to the story.
Well,
physicians is that we want healthy patients.
Yeah, well, look, I completely understand that the doctors these days face all kinds of obstacles in just trying to practice the trade that they went to school for so long, to say nothing of the overhead of trying to run an office and so forth and so on. But from a consumer standpoint, for the patient, I mean, half the time I go in, I talk to a physician's assistant anyway, never even see the doctor, which is okay. I trust the PA. But and you talk about touching people. Well, in most cases, we're simply talking. You got a headache? Yes, I got a headache. Where is it? Right here. Over here? Yes, it's over here. There are a lot of times when it doesn't seem like you actually need a physical examination, which takes you into the office. In fact, I would be willing to pay for the phone call if I could actually get the doctor on the phone for 4 minutes.
I understand your frustration as a patient. I truly, truly do. And medicine is moving to more of a personalized approach, where we can now look at your actual genomes, we can measure amino acids, fatty acids, organic acids, and really prescribe individualized care. So medicine is changing from that viewpoint anyway. And I understand your frustration as a patient. There are a lot of ways that we can help facilitate and help the patient, probably more than we do now from a consumer perspective. So I agree with you.
Oh, well, thank you very much, Dr. Smith. I wasn't trying to do a rant there, just expressing frustration I think a lot of people have, and the opportunity to just be able to make a phone call and get a prescription is pretty cool. Appreciate your time.
I totally agree with you. For more minor things like a sinus infection, that would be a great way to look at things.
Right.
Dr. Pamela Smith, Director of the Center for Personalized Medicine in Michigan. KLIF News Time is 6:46.